Hello and welcome back to What the Health. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News, and I'm joined by some of the best and smartest health reporters in Washington. We're taping this week on Thursday, September 12th at 10 a.m. As always, news happens fast and things might have changed by the time you hear this. So here we go. Today, we are joined via teleconference by Cohrs Zhang of Stat News.
Hi, everybody.
Riley Griffin of Bloomberg News.
Hey, hey.
And Lauren Weber of The Washington Post.
Hello, hello.
I hope you enjoyed last week's special episode on health equity from the Texas Tribune Festival. Now we have a lot of news to catch up on, so we will get right to it. We're going to start with politics and with the much anticipated presidential debate Tuesday night. Obviously, the big health issue was abortion. And as I said afterwards on the radio, the most consistent thing about former President Trump's abortion position is how inconsistent it has been. Did we learn anything new from everything he tried to say about abortion?
I think he didn't provide a lot of clarity on kind of the issue of whether he would veto a nationwide abortion ban. And I think that has been kind of the question that is kind of hard to nail down. And his response is that, well, that's not going to pass Congress, so I won't have to worry about it. And
which is kind of true. I mean, it's not going to pass Congress. That was Nikki Haley's point.
Yeah. So I think we have seen, though, some talk floating around about ending the filibuster for abortion from Chuck Schumer's side of things, at least. So I think it's not completely out of the question to think that things could be different in the future. We don't entirely know. But that's his argument that I don't really have to answer that question because it's not actually going to happen. So I think that's not really an answer to the question.
Riley.
It does beg the question what he has to gain from answering that question. You know, if he says he supports vetoing a national abortion ban, it's certain to anger some of his base. And the opposite is true, too. He's been threading a really tenuous needle here in trying to appease very different crowds within the Republican Party. And I think that is perhaps at this point more interesting to think about his positioning around abortion than the Democratic Party.
So this is where I get to jump up and down and say for the millionth time, he doesn't have to sign a nationwide ban to ban abortion nationwide. This is where the Comstock Act comes in that we have talked about so many times and that Project 2025 talks about starting to enforce it, which it has not been in decades and decades, but it is still on the books. And a lot of people say, oh, they could ban the abortion pill by enforcing the Comstock Act, which bans the mailing of things that can be used for abortion. But as others point out, it could be not just the abortion pill. Anything that is used to perform any sort of abortion travels in the mail or FedEx or UPS, all of which are covered by the Comstock Act. So, in fact, he could support a nationwide abortion ban and still say that he would veto legislation calling for a nationwide abortion ban.
Right. And it seems like when he's been questioned about this in the past, he hasn't quite understood or seems like he understands kind of the nuances of that. And I think our frequent panelist, Alice Olstein, had some good reporting indicating that the pro-life groups wanted more commitments from him on like the Comstock Act and aren't getting them. So I think there are certainly some questions out there. But as a reporter in D.C., we have the privilege of covering healthcare almost exclusively. And sometimes you can tell when a lawmaker or a public official doesn't understand the question. And I think that's a little bit of what's happening here. But obviously, it's his campaign's job to prep him and make clear what his position is so voters can make an informed decision.
And of course, with Trump, you're never sure whether he really doesn't understand it or whether he's purposely pretending that he doesn't understand it.
Right.
Lauren, you wanted to add something?
On a lot of issues, Trump doesn't necessarily always give a straight answer and often walks them back. So, I mean, it's somewhat, representative of also playing, as Riley pointed out, to political points as we get so very close to the election and to pick up some of the folks that are undecided. So, as you said, we didn't learn much.
So what about Vice President Harris? Those of us sitting here and those of us who listen to the podcast know that she's been on the trail talking about reproductive health since before the fall of Roe. It's an issue that she is super comfortable with. I was, I think, surprised at how surprised people watching were when she was able to articulate a really thorough answer. Did that surprise any of you?
That did not surprise me at all, but I think what was so shocking about it was everyone remembers where they were when Joe Biden got the abortion question at the debate not so long ago and truly butchered that answer. I mean, that was one of the worst moments of the debate for him. He really could not get through it. I mean, the man has notoriously not felt comfortable talking about abortion, older man, Catholic, etc. But the contrast, I think, is what was so surprising, because Democrats consider this a very much an essential issue for winning the election. Abortion issues are polling incredibly well. Obviously, with women, you have abortion rights on the ballot in several states, including swing states. I mean, this is kind of a make or break issue to win the presidential for Democrats, and for Kamala Harris to be able to give not just a coherent answer, but one that actually had some resonance, I think was just so markedly different that people ended up as surprised, as you pointed out.
Just want to add here that this is a space that she is so incredibly comfortable talking about. I mean, on the campaign trail, even before she assumed the top of the ticket, this had been her marquee subject. And I've been moonlighting as a Kamala Harris campaign reporter for the last few months. Every rally you go to, this is where she gets the biggest applause. This is the note that strikes, that resonates with the crowd. She had been doing what she called a reproductive freedom tour through swing states for months prior to assuming the top of the ticket. So it's no surprise that she is quick not just to talk about the stakes of the overturning of Roe v. Wade, but also fact check the former president. There was a really fitting moment during the debate where she said, nowhere in America is a woman carrying a pregnancy to term and asking for an abortion. That is not happening. So that she could not only come and deliver the lines, but also listen to Donald Trump, respond to some of the factual errors, right, in real time was again a marked difference from President Joe Biden.
Yes, it was a very different debate, I will say. There was actually a bit surprising to me also some discussion of the Affordable Care Act. Apparently, Donald Trump is now saying that he's the one who saved it, which is not exactly how I remember things going down. Is that an acknowledgement that the ACA is now here to stay? Or should we still assume that if Republicans take control of the White House and Congress, they will, at the very least, let those expanded ACA subsidies expire?
I think there's a very good chance that those subsidies do expire. Just obviously depends on control of Congress and how much leverage Democrats have and what they're willing to give up to get them. And again, it's kind of difficult because a lot of the states that benefit the most from these subsidies are Republican states that have not expanded Medicaid. So I think there are some difficult political considerations for the Republican caucus on that issue. But I think, like, Trump was implying that maybe he could have done more to sabotage the ACA without actually repealing it. So
that's kind of true.
Yeah. So I think that was an interesting point. And of course, he returned to the refrain that he's going to have a plan. We haven't seen a plan for 9 years, but
concepts of a plan.
Yeah, we'll see it soon.
I think it's important to also fact check Trump on saying he improved the ACA. I want to read a list of things from a great stat article. While in office, Trump's administration shortened open enrollment periods, cut funding for navigators who help people enroll, expanded short-term insurance plans, lowered standards for health benefits provided by small employers that banded them into larger groups, and enabled employers with religious or moral objections to contraceptive coverage to opt out of requirements to provide no-cost coverage. So, I mean, I think some of his assertions about improving the ACA are up for debate, depending on how you feel about that list of things I just read.
And you can also see the impact in enrollment. I mean, we had some really interesting data released just before the debate, conveniently, by the Treasury Department, showing that the Biden administration had ushered in this all-time high enrollment in the ACA insurance marketplaces. But what was also tucked into that data was that under the Trump administration, there was also pretty significant lows compared to the other parts of the last 10 years. So that's notable, too.
Yes. And actually, you're anticipating my very next question, which is, while we are on the subject of the ACA, the Census Bureau was also out this week with its annual estimate of people without insurance. And surprise, even with the Medicaid unwinding and people being dumped off of the Medicaid rolls, the 2023 uninsured rate of about 8% percent remain near the all-time low that it achieved under the Biden administration. Now, this is not the complete picture of the uninsured, those who lost coverage at any point during 2023, which is when everybody on the unwinding lost coverage, wouldn't be counted as uninsured for the purposes of this particular survey, which counts people who were uninsured for the entire year. But the Biden administration the day before released an analysis finding that over the 10 years that the Affordable Care Act marketplaces have been operational, 1 in 7 Americans has been enrolled in one of the plans. Is this a first election where the ACA could turn out to be a boon for its backers rather than, an albatross around their necks?
I mean, I think KFF polling recent numbers say some 60% of Americans support the ACA. So that would be a majority of Americans that would be very unhappy if it was repealed. So, I mean, to your point, Julie, I think the popular opinion has shifted on the ACA, and we're in new ground here.
I mean, even in 2020, I think after all of that happened, I think there was this realization that maybe this isn't a viable option, so we should stop promising it to people. And I think Democrats had gotten so much momentum on all of the claims that Republicans did want to take apart the ACA. And we saw that conversation in the Supreme Court as well. And I think that reality has just become so much more real with Dobbs and saying that when the makeup of a court changes, court decisions can change, and that elections matter in that calculus. So I think we started to see the movement in 2020, but obviously there was so much pandemic going on that I think some of these other healthcare lines got lost in that election that we're seeing come out a little more clearly this time around.
And of course, despite Donald Trump now becoming a latter-day champion of the ACA, sort of, if Republicans win back control of Congress and the White House, we've got both these expanded subsidies that, as we pointed out, have enabled this big enrollment expiring and the Trump tax cuts expiring. It's hard to imagine both of those getting extended. One would think that the Republicans' priority would be the tax cuts and not the subsidies, right?
Yeah. Again, depends on whether Democrats are able to hold a chamber of Congress and what kind of leverage they have.
Yeah. That's obviously a 2025 issue. Well, turning to elected officials who are already in office, today is September 12th, and that means Congress has basically 8 more working days to avoid a government shutdown by either passing all of the 12 regular spending bills or some sort of continuing resolution to keep agencies funded after the October 1st start of fiscal 2025. This is where I get to say for the millionth time that when Congress settled the funding for fiscal 2024 last, checks notes, March, House Republicans vowed again to have this year's funding bills finished on time. Rachel, that did not happen. So where are we?
It does not happen. Yeah, I think it's business as usual around here. I think, honestly, the posturing has started earlier than I expected with the House Speaker Mike Johnson putting out, this proposal for a CR that he couldn't even get through the House. He kind of pulled that before it came to a vote on the floor. So I guess that's at least an opening salvo earlier than we see usually early in September.
Well, this was the big fight about do we want a CR that goes to after Thanksgiving, which would be the typical CR, and then we'll come back after the election and fight about next year's funding, or in this case, they wanted a CR that went until next March, I guess, betting that maybe the Republicans will be in charge then and they'll have more of a say over this year's spending than they do now?
Right. I think that's certainly an open question. And I think it seems like Senate appropriators are not necessarily on board with that March timeline at this point. They really would like to wrap things up in December. And again, I think looking back in 2020, we did see a really significant appropriations package with a lot of healthcare policy pass at the end, kind of in the December timeframe of 2020 in lame duck. So I think it's a really big question. And then the other question is, do all these expiring healthcare programs that are currently slated to end in December get extended with that appropriations package? I think there's just a lot of moving parts here, and we don't exactly know what the deadlines are going to be yet. But at least they're, arguing about it in the public sphere. So that's a start.
They're legislating. That's what they do. Lauren.
I just wanted to say, Julie, I think you should have a segment that's a tally of how many times you ask on this podcast if the funding bill has passed. Because I know myself, I've been on many, and I really think it'd be kind of funny. So I'm just saying it's quite fascinating over the years, the many, many times these bills do not seem to make it.
This is just me as the, lifelong Capitol Hill reporter who, we're always talking about what's going to happen next year and the year after. It's like, you have a job to do this year. Let's see how you're doing in the job that you have to do this year. Does anybody think there's actually going to be a shutdown? I mean, that's still a possibility if they don't get a deal, although that would be I'm trying to remember if we've ever seen a government shutdown in a presidential election year. That seems risky politically. Riley, I see you sort of raising your eyebrows.
I mean, it's definitely risky and clearly something right now you can see the Biden administration wants to avoid. I was sitting in the White House press briefing room on Monday, and Karine, the press secretary, was like, this is Congress's one job. This is their main job. It's to keep the government open. So there's a level of frustration that I think this is coming into the discourse yet again, but to be expected.
Yeah, and I should point out, it's not just Republicans that are unable to get funding bills done on time. The Democrats are unable to get their funding bills done on time either. I believe that the last time all of the funding bills were actually passed before October 1st was the year 2000.
This is why this should be a Julie segment. I'm telling you, you should run a tally.
Well, it is kind of a Julie segment.
Yes.
And I will keep at it because this is my job too. All right. Turning back to abortion, in the debate Tuesday night, Vice President Harris talked at some length about some of the unintended consequences of abortion bans, as we discussed. Women unable to get miscarriage care, girls being forced to carry pregnancies resulting from incest all the way to term. Now we have another new potential health risk. In Louisiana, the new law that makes the abortion medications mifepristone and misoprostol controlled substances is resulting in a major disruption to hemorrhage care. It seems that misoprostol, which is used for a variety of purposes other than abortion, it was originally an ulcer drug, is a key emergency drug used in a wide variety of reproductive health emergencies, and it's not clear what will take its place on emergency carts since you can't have controlled substances just hanging around in the hallways. Is this yet another example of lawmakers basically practicing medicine without a license?
I think that's right, Julie. You know, I spoke to a Louisiana ER doctor last week who put it pretty bluntly. He's like, look, I have a woman who's bleeding out in front of me, and I need to call down to the pharmacy and put in an order that could take not just seconds, not just minutes, but many minutes, even longer in possibly rural pharmacies where, you know, the access may not be as readily available. He's like, this is truly a life or death issue. I mean, women, when you are bleeding out from post-birth complications, which, by the way, is not as uncommon as people would like to think it is, this is really quite something. And so, you know, folks in Louisiana are obviously very up in arms. I think it speaks, as you pointed out, to the larger environment that Kamala Harris has pointed to, and many, you know, reporters that have been on your show and that we have discussed many times on the show, is that there are many unintended consequences for laws that limit abortion and for women seeking access to care, where hospitals, afraid that they're not going to interpret the law correctly, are leaving women to seek care elsewhere. And what are the health ramifications of that? But this is a pretty frightening unintended consequence.
Yeah, this was something that was not aware of. I mean, I had not seen. Of course, Louisiana is the first state to, you know, basically declare these controlled substances. So it seems that every time we get kind of a new restriction, there's a new twist to it that I think most people did not expect. There's also been lots of court actions, obviously, on abortion in the past few weeks. In Missouri, last week, a judge tried to strike the state's abortion rights referendum from the ballot, although this week, a higher court ordered it back on the ballot. I believe that's the final word on Missouri. They will vote on it in November. In Alaska, a judge struck down a state law that limited who could perform abortions to just doctors rather than doctors and other medical professionals. And in Texas, Attorney General Ken Paxton filed suit against a new federal rule that shields the medical records of women who cross state lines to obtain an abortion in a state where it's legal, which it's not in Texas. It would seem the implication here is that Texas wants to prosecute women who leave the state for a legal medical procedure, or am I misinterpreting that somehow?
That's my understanding as well, and it's a development that I believe the rule was announced in April when Biden had said that no one should have their medical records used against them. And, you know, lo and behold, we're a few months later, but this Texas lawsuit does suggest that this could be a part of criminal prosecution.
I know. I mean, this seems to be sort of this underlying issue of what happens to women who live in banned states who go to other states to obtain abortions. And there's been a lot of back and forth, and a lot of people, I mean, even on the anti-abortion side, trying to say that this is not our intent, but this certainly seems to be the intent of some people. Seeing nods all around. We will continue to follow this string. Finally, this week, I want to talk about mental health. Over the objections of some insurers and large employer groups, the Biden administration finalized the latest set of rules attempting to guarantee parity between coverage for mental health and substance abuse and every other type of medical care. This is literally a 30-year fight that's been going on to regularize, if you will, coverage of mental health. This action comes just as ProPublica is unveiling a pretty remarkable series on the inability of patients, even patients with insurance, in fact, mostly patients with insurance, to obtain needed health care, often with catastrophic consequences. Rachel, one of those stories is your extra credit this week. Why don't you tell us about it?
It is, yes. So my extra credit is I Don't Want to Die, Needing Mental Health Care. He got trapped in his insurer's ghost network by Max Blau in ProPublica. And I think this story kind of really makes clear the consequences for certain patients, especially mental health patients in crisis, of when the list that you get from your insurer of in-network providers is inaccurate. And I think, ghost networks, it's kind of a weird, jargony term, I think. There have been some hearings on the issue on the Hill, but when we think about somebody who desperately needs some crisis counseling and they're doing everything they can with they're exhausted, they're already dealing with so much, to already have to call provider after provider who doesn't take their insurance anymore, doesn't know what they're talking about. It's just such a frustrating process that I think many of us have experienced. I personally have experienced it, getting an MRI in Los Angeles, and the list is out of date. And I think there's definitely room for regulation here. And I think that mental health care through this series was just highlighted as such an important part of that conversation.
Yeah, I mean, we've all sort of had this, and we've all written the stories about people who, can't have lists of in-network providers and can't find one, or can't find one who's taking new patients, or the provider there does not do what the directory suggests that they do. They may, say they may only treat children, or they may not treat children. But I think in mental health, I mean, these are people in mental health crises trying to get care that they are guaranteed by law and guaranteed under their insurance, and being unable to do it. And as I say, sometimes not unoften with catastrophic consequences. Needing mental health care is not just somebody who says, oh, I don't feel well today. I mean, these often are people who are in actual crisis situations. So speaking of people who are in actual mental health crisis situations, the New York Times has a piece this week on a chain of mental hospitals that's basically holding patients in their facilities against their will to get as much as they can collect from insurance. In some cases, patients' relatives have had to get court orders to get their patients released. How did we let our mental health system get so far off the tracks? I mean, either you can't get care or you get care that you can't get out of.
Well, this piece by Jessica Silver Greenberg and Katie Thomas, which, I mean, is truly phenomenal. Everyone who's listening to this should read it. Makes a very astute point, which is that the government and nonprofits have really gotten out of the psychiatric hospital business, and for-profit companies have swept in. And they interview several former employees who make it very clear that these were run with profit incentives in mind, of holding patients to maximize the insurance money they could get to catastrophic effects. I mean, the details in this are wild. I mean, they talk about people having to go to court to get folks out, very clear violations. And again, they speak to not just one, not just two, but multiple former employees who allege that this company was acting in such a way that was not for its patients' best interest.
Oh, and I do have to do a plug for my colleague Tara Bana, who also reported on Acadia and how they're kind of operating mental health institutions under the brand names of Catholic hospitals. So people might even think that they're going to, a well-respected community hospital under the name, but these for-profit institutions have even made their way into not-for-profit spaces, and these services are just being contracted out because they're simply unprofitable.
And we talked about Tara's story when it came out.
We did, yeah.
So I think 2 ago, yeah.
Yeah, this next story is a great kind of building just a fuller story around the implications of for-profit.
It does sort of, both
actors.
This, I think, and the ProPublica series highlight, in the 60s and 70s, the problem was people who were in state-run facilities, and they were warehoused, and they were underfunded, and people, just didn't get the care that they needed. And that was one of the things that led to deinstitutionalization, which, of course, is one of the things that ended up leading us to the homeless, because when they deinstitutionalized these patients, they were promised outpatient care, which never materialized. So now we've kind of profitized this, if you will, and we have a different set of problems. It's every bit as bad. It's kind of a microcosm of the entire healthcare system. It's like, well, we don't really trust the nonprofit sector to run it right because they don't have enough money. And now we don't trust the for-profit sector to run it right because they have too much of a profit motive. Is there any middle ground here?
I think we could spend weeks. You could have a whole podcast just dedicated to this question, and it's a harrowing one. And there's a parallel discussion to be had also about the centers that navigate patients who are seeking treatment for substance use, right? Often those are one and the same, but I think the same dynamics are playing out here. And to the mental health parity regulation that was finalized, that included substance use benefits too. It wasn't just mental health. So yeah, I don't know. I say with a heavy heart that we could talk about this a long time, but I don't have any answers for where the best care is going to be.
Yeah, none of us, I think, does, and that's why we were all going to have jobs from now into eternity as we at least keep working on this. All right, well, that is the news for this week. Now it is time for our extra credits. That's when we each recommend a story we read this week we think you should read too. Don't worry if you missed the details. We will include links to all these stories in our show notes on your phone or other mobile device. Rachel, you've already done yours. Lauren, why don't you go next?
So I picked a story from Stat titled "Youth Vaping Continues Its Tumble from a Juul-Fueled High," written by Lizzie Lawrence. And I was really struck, I'm sure public health officials are really struck by how far vaping rates have gone. I mean, they're down to 6% of middle and high school students using vapes in 2024. That's down from 8% last year and 20% in 2019. I mean, that is a marked change. And I expected to read this article and see, but don't worry, they're all using Zyn, which is another nicotine product. But actually, that had only gone up to about 1.8%. It was not nearly the same bit. And I think if you're a public health official, you're got to be pretty pleased with yourself. Because, I mean, this would seem to show that the public health action that they very aggressively took at both the federal, national, and in some places locality level to limit flavored vapes and other, have other actions for kids has resulted in a pretty steep decline, much faster than you saw cigarette use decline. So I was really impressed to see these numbers. It's quite a change.
Yeah. Yay, public health. Riley.
Yeah, I want to tout a story from my colleague Madison Muller. It's titled "Lilly Bulks Up Irish Operations in Obesity Drug Production Push." And she's actually in Ireland right now. She was reporting out this story. Ultimately, we all know there's been this immense demand for obesity drugs. Eli Lilly and Co. has two, Mounjaro and Zepbound, and they just can't seem to build out production quickly enough. My colleague did some data analysis here and actually found that since 2020, believe it or not, Lilly has poured $17.3 billion into weight loss drug manufacturing. I mean, what an insane number. And the latest push is in Ireland, which is notable because here in Washington, there's been a lot of work to scrutinize and even prevent U.S. drug makers from collaborating with Chinese manufacturers of biologics. So sometimes they talk about nearshoring or friendshoring in D.C., which is really a kitschy term to refer to seeing more friendly countries to the United States be bolstering up manufacturing. And here you see Lilly doing just that. So it's a fun story. And kudos to Madison, who went out to Ireland to tell it.
I'd love to be sent to Ireland.
Yeah, I need to pitch more stories in Ireland. I mean, what? That's amazing.
Just saying. It is a good story.
Yeah.
All right. Well, my story this week is from the Wall Street Journal by Rebecca Ballhaus, and it's called "A Nurse Practitioner's $25,000 in Student Debt Relief Turned into a $217,500 Bill from the Government." And it's a really infuriating story about a really excellent government program called the National Health Service Corps that helps medical professionals pay off their loans if they agree to practice in underserved areas. The problem is that there are penalties if you fail to complete your term of service, which obviously there should be. But in this case, one of the nurse practitioners supervising physicians died and the other one retired, and there were no other eligible placements within 2 hours of her Alabama home where she cared for her 3 young children as well as her elderly parents. Obviously, there should be consequences for breaching a contract, but this is far from the only case where people who are obviously deserving of exceptions are being denied them. The National Student Legal Defense Network has filed suit on the nurse practitioner's behalf, and I'll be watching to see how this all turns out. Okay, that is our show. As always, if you enjoy the podcast, you can subscribe wherever you get your podcast. We'd appreciate it if you left us a review. That helps other people find us too. Special thanks, as always, to our technical guru, Francis Ying, and our editor, Emery Hudeman. As always, you can email us your comments or questions. We're at whatthehealth, all one word, at kff.org, or you can still find me at X. I'm at J. Rovner. Riley, where are you hanging these days?
I'm on X, though infrequently, at Riley Ray Griffin.
Lauren.
Still only on X at Lauren Weber HP.
Rachel.
Still on X at Rachel Cohrs.
We will be back in your feed next week. Until then, be healthy.